Hi, my name is Gwen Darien, and I'd like to welcome you to our Learning from Communities, the National Patient Advocate Foundation's Spring Policy Consortium. I thank you for participating, and I hope that you'll participate actively throughout the course of this afternoon, which is going to have a really packed agenda. We have a chat, and please comment, please ask questions, please say anything that's on your mind and offer insights during the presentations. There are a few interactive presentations, and there are presentations in multiple media. So I just wanted to, of course, thank you for coming, and also give you a little bit of a sense of the genesis of this particular policy consortium. As some people know who've been participating in a number of our policy consortia, we build upon the policy consortium that has come before this one, as well as building on what we learn both from the patients that Patient Advocate Foundation serves, as well as what we know is going on in the healthcare ecosystem. And this time we really wanted to focus on learning from and working with communities and talk about some of the best practices, and not just community engaged research, but really community driven and patient driven research. So one of our inspirations, one of our kind of foundational goals is that we always learn from people. We don't learn about people. And I think it's a really important, while it may seem very nuanced, but it is a very important distinction. And one of the reasons why it's so important is learning from communities really means that the answers are in communities, the solution lies with the community, the goals and the objectives of everything we do have to reside with patients, families, and community. So therefore, you learn from someone, you listen, you actively listen, you deeply listen. You do not go in and think about what you want to do, what you want to say, what the questions are that you find of interest to you. So this is something that's been woven through all of our policy consortia, particularly the last few policy consortia, but it is a foundational principle of our work. So in this policy consortium, we're going to hear from some of our longtime partners, and we also have a deep commitment to creating sustainable, enduring partnerships in which we co-create all of our initiatives and all of our programs. And we're going to meet some new friends and colleagues, and we have a very rich and very full agenda. So if we could have the first slide, please. So some of our last policy consortium was about identity in the healthcare experience, another theme that runs through all of our policy consortia. But a lot of the things that came up in this policy consortium really have set the stage for what we're doing, what we will be doing today. And we were very honored to have Isabel Wilkerson, the author of Caste and Warmth of Other Suns, as our keynote speaker last time. And I wanted to start with setting the stage by what she talked about as the difference between empathy and how you turn that into radical empathy. So empathy and empathy also has been a subject of much debate and discussion in patient advocacy circles and patient group circles and community-based organization circles. So empathy is not sympathy. Sympathy is looking across from someone and feeling sorrow, often in times of loss. Empathy is not pity. Pity is looking down from above and feeling a direct sadness for another in their misfortune. Empathy is commonly viewed as putting yourself in someone else's shoes and imagining how you would feel. This could be seen as a start, but that is little more than role-playing, and it is not enough in the ruptured world in which we live in. Ms. Wilkerson then goes on to talk about what radical empathy is, and I think this is really, if we thought of something that really described what we were doing in all of our work, and I hope all of your work and our work together, this would be it, which is radical empathy. Radical empathy means putting in the work to educate yourself and to listen with a humble heart to understand another's experience, from their perspective, not as we imagine we would feel. And I think this is just exemplifies what learning from communities are, what community-led, patient-driven research and engagement is all about. Next slide, please. Next slide, please. Partnering by invitation only. So one of the other inspirations for this policy consortium, and I'm very pleased to say that Katie Cueva and one of her community partners, Jim Chaliak, are joining this conversation today. They will is a notion that she talked about, which is partnering by invitation only. And one of the questions she says she always asks is, what is it that brings you, meaning the researcher here? Is it because it has to be because you've been invited and you've been asked. You can't just go into a community without being invited in, and you can't go into a community to research and learn about something that satisfies your intellectual curiosity. Whether you are a researcher, whether you are anybody else, an advocate coming in from the outside, it really is an invitation. The other thing that, and it's an invitation by the community. The other thing that Katie talked about, which was so important, and we'll talk about a little bit later today, is that you can always be asked to leave. You are there by the invitation of the community and the people from whom you learn. You are not there. They can always ask you to leave. Next slide, please. So another of our long-term friends and colleagues who we've done a number of projects with is Kellen Baker, who's the director of the Whitman Walker Institute. And as health equity is the underpinning for everything that we do. It's the underpinning. It is our foundational value. It is our driver. It is, as many people like to say, our North Star. So this is a quote from Kellen from a podcast that he did with us a few months ago. The highest goal of health equity. One of the highest goals of health equity is to make it possible for everyone to be who they are, based on their identities, based on their bodies, based on their circumstances in life. Full and whole human beings, living our lives the way that we want to and the way that is the most meaningful to us. And I think that if we consider how health equity, how this fits in with learning from communities and working with communities, this is one of the most important goals that we have, which is to allow people to find who they are, bring their full selves without any fear of judgment, without any fear of barriers to healthcare, without any fear of not being represented as they would like to be represented in the development of the healthcare delivery system. Next slide, please. So another very long-term partner, actually two long-term partners and friends who will be part of this policy consortium are Alma McCormick from the Crow Nation and Suzanne Held, who is her research partner at Montana State University. And I think it's another theme that you will see going through this policy consortium is the idea of trust, trustworthiness, and authenticity. And Alma and Suzanne are emblematic of this, of building trust over a very, very long time. You'll hear their story, but they've been working together for decades. And one of the things that they point out very clearly and live and live and embody is that building trust is a lifelong endeavor. You don't just build trust and then walk away. You continue to build trust. Another quote that I just love is from Donald Berwick, who is a physician and a researcher and a thinker about many of these things. And in a recent workshop, he said, trust does not survive inauthenticity. And I think you'll see that notion of really authentic partnerships and as opposed to inauthentic partnerships throughout the course of this policy consortium. Next slide, please. So I wanted to quickly go through our agenda. I actually am over time, and you will see, and as you can see, we have an incredibly full day. This is our slide number 1. We have documentaries, we have conversations, we have an interactive workshop, 2 interactive and an interactive presentation. We have a panel. Next slide, please. And we have a presentation about what we learn from our patients, about measuring what matters in meaningful community engagement, which is a presentation about a co-created work about community engagement. A conversation, we finish with a conversation between Jim Chaliak and Katie Cueva, who I've mentioned before, and then a Advocates in Action podcast excerpt. And Advocates in Action is the podcast series that we do that precedes all of our policy consortia. And also and this one is called The Tide That Lifts All Ships. So I've been working in patient advocacy for more than 25 years now. I've worked since my first diagnosis of cancer. I'm a 3-time cancer survivor. And when I started working in advocacy, because advocacy has very much evolved, what we all wanted was we wanted a seat at the table. We wanted to be invited. We wanted to be invited into the research enterprise, if it was the research enterprise or the healthcare delivery system enterprise or in order to have a seat at the table. And for us, that was a very, very high goal. And it was also something that was unusual. It was that the seat at the table was really pioneered by the AIDS and HIV activists. But as time went on, we didn't just want a seat at the table. We wanted to be part of the building of that table. We wanted to be part of we wanted to make sure that there wasn't just one seat at the table. Many advocates, many patients, I'm often the only person who's talking from the patient or the patient advocacy lens. And I think one of the transitions that we really aspire to now is that we want to build the table, we meaning patients, families, and communities, and invite other people to sit at that table with us. So that's really the theme and the call to action for this policy consortium is how can we build the table? How can we make it be driven by patients, communities, and families, and invite others to sit at the table with us? Next slide, please. So before we go into our first presentation, I just wanted to thank our policy consortium members, without whom these presentations and these interactive presentations and our ability to convene people from all over the country would not be possible.